Well, hey everyone, it's good to see folks. My name is Moses, and I just want to say first of all, thank you so much to every single person who was on tonight and who shared tonight. I think that you know the issue of healthcare touches all of us, and we all either have a story or know someone who's been impacted by this. And so I just feel really grateful that we can be here for a kickoff for this week of action in this space and just have this space for this spiritual home for us to reflect a little bit on this and to think a little bit together and to prepare for the week to come. And before I go into the week of or the call to action, I hope it's okay. I'm in Washington right now with Tani, and we're working on his book and we're doing some research. And in particular, we're here because he has a friend here who Rick Abraham, who he did a lot of organizing with the United Farm Workers in Mississippi. And he has all these archives, like he just has these boxes of archives. And so we've just been spending like the last couple days going through these. And yesterday, when I was going through these archives of the United Farm Workers in like the early 70s, the 1973, I found this piece that I thought was really interesting. It was a resolution that was basically from a smaller union, kind of being passed to a bigger union and asking them to join. And what they were asking them to join and support them on was a resolution to support national health insurance. And so this was like early 1970s, 1972, about. And so I thought I would just read some of it because, especially I think, Mike, when you were talking, I think another narrative we get to is that these issues are new or it was different. This is something that we've not been struggling with, but this is from early 1970s. It says, whereas some Americans receive no medical care, many Americans receive poor medical care. Our nation's medical care delivery system is largely unplanned, uncoordinated, and duplicative, so that facilities and manpower are inefficiently utilized. And whereas local union and health and welfare coverage is neither the best nor the worst of all of these individual healthcare programs, they are tied to the economic structure of particular industries and unfortunately often reflect the collective bargaining skill of union officials and the resistance of management. And whereas the logical answer to this inequitable and poorly planned system of healthcare is for the organized working men and women of this country to band together with other citizen groups to press for national health insurance. This vast lobby for total health care should press for an end to this attempt of private groups to restrict the supply of physicians, for an expansion of legislation to construct hospital and clinic facilities for full federal scholarships and for nurses training in all related healthcare skills. And whereas total comprehensive healthcare for all Americans is a right, not a privilege based on financial status. Therefore, it should be resolved that this union join on local and national levels with trade unions and other groups and friends of national health insurance in the Congress to support the most comprehensive national health plan by organizing an effective program of public education and support of the necessary legislative changes so that good health care no longer continues as an accident of birth or social or economic conditions. And this was a resolution referred to the Committee on Resolutions. And so this is something that is from the early 1970s. And when I was talking to Tani today about his experience in organizing in this drive, and right before this, he was organizing with Popewood haulers, he told me that one of the biggest things he learned was that this was a time in organizing where folks were told that white folks had to organize white folks and Black folks had to organize Black folks, and Latino folks had to organize Latino folks, and we weren't supposed to be organizing in these multiracial groups together. But when Tani was organizing Pulpwood haulers, they were Black and white, and so they just had to organize them together in a multiracial group. And what they found, as he said, what we found when we did it was that it was possible, that it could be done, and it was done. And when it was done, the powers that be were scared, and the powers that be were fearful, and they came in and they tried to break us up. But we saw that it was possible to come together and to organize people based on a shared economic struggle. And we saw that it was possible to build power with folks. And I think we carry on this legacy today, and we continue to take this legacy with what we're doing. And so with that, I want to encourage folks to really join us this week. As we said, this is kind of the kickoff. It technically started yesterday, but the NVMA National Week of Action is happening September 21st to September 28th. And we are so happy that there's about 21 actions, I think, in counting, across 12 states. And so we are going to put a link to the chat to the Nonviolent Medicaid Army Facebook page. And we ask that you check it out. There are actions, they might be happening in your state, but there are also actions that are definitely happening online, and you can tune in and support. And we also ask that you share it out. We ask that you share out these actions, that you show your support for what we're building and what we're doing. And we also ask that you check out our Medicaid Monday stories. This past year, we've been sharing every Monday. Folks have been talking about their experiences on Medicaid, talking about their experiences with our cruel health insurance system. And we ask not only for you to share out those stories, but if you have one of your own that you'd like to share, we encourage that too, because we are really trying. We're trying to not just like uplift our words and bring this, really bring this to the present mind of folks, but we're also coming together, to really organize and build. And so as much as we can really uplift what's happening around the country this week, we expect this to be a super powerful and impactful week, and something that will kick off a continued organizing that doesn't stop this week, but this is a week where we're really uplifting what we're doing.